With the distribution of the first doses of a coronavirus vaccine possibly just weeks away, the Alabama Department of Public Health discussed its planning for receiving and distributing the vaccine. WAAY 31's Sydney Martin is live in Huntsville tonight after learning more about the 3 vaccines.
Dan, State Health Officer Dr. Scott Harris said today that the Department of Public Health the Department of Public Health received help with the CDC with its vaccine distribution plan, and they said that that plan will be finalized in the first week of December.
Hearing that all 3 of the products so far have 90% or more effectiveness. The AstraZeneca, at least in one of its dosing regimens, has about 90% effectiveness. The higher the effectiveness, of course, the fewer number you actually have to reach. But I think our goal is to make sure we're protecting all those people who are most vulnerable.
State Health Officer Dr. Scott Harris said with the steady increase of coronavirus cases during the past 6 weeks, news of vaccine could be weeks away with multiple providers seeing high rates of effectiveness is encouraging. And now they're working to determine who will be able to get it, with only 112,000 doses expected to come to Alabama initially.
We have a proposal that we've circulated to the physicians on the governor's coronavirus task force to get their input. They were the same group that helped us making the ethical decisions around remdesivir.
Harris explained they think they've identified different groups of high-risk healthcare workers.
Those workers who are known to be working with COVID-infected patients, those workers that are involved in procedures like aerosol generating procedures that put them at particularly high risk, those workers who are involved in mortuary work.
Harris said the vaccine most likely won't be available to young children or pregnant women, and each vaccine could target a specific age range or population.
Really hard to make a blanket statement, one-size-fits-all statement about that. Ultimately, taking a vaccine is something that's going to be administered to you by a healthcare provider, and that healthcare provider is the best source of information on that.
Now, Harris said today they're still trying to figure out where exactly you can receive a vaccine once it's ready to be distributed. He said possibilities outside of a traditional doctor's office could include a dental office, community health centers, as well as pharmacies. Live in Huntsville, Sydney Martin, WAAY 31 News.